Hello everyone, our project is Adaptive AI Assistant Triage for Inclusive and Sustainable Healthcare. We explore how adaptive AI can continuously prioritize vulnerable patients while responding to changing healthcare demand and resource constraints.
Traditional triage has a fundamental limitation. It focuses mainly on clinical severity while overlooking the broader factors that shape real patient risk. In overcrowded emergency departments, staff shortages and long waiting times can mean that vulnerable patients, such as those from rural areas, migrant communities, or disadvantaged backgrounds, can easily be under-prioritized. This problem persists because healthcare systems operate as interconnected feedback loops. As our causal loop diagram shows, overcrowding increases waiting times and delays treatment, leading to worse outcomes and longer hospital stays. These, in turn, place even greater pressure on hospital capacity. At the same time, workforce shortages reduce assessment quality, while language and cultural barriers increase the risk of incomplete assessments, causing high-risk patients to be missed. To break these reinforcing loops, we proposed adaptive AI triage. Instead of relying only on clinical severity, it continuously integrates clinical risk, social vulnerability, and real-time resource capacity. By dynamically updating patient priorities, reallocating resources, and learning from new data, the system delivers the right patient, the right priority at the right time.
Traditional triage mainly focuses on clinical severity. Our proposed adaptive AI explains this by integrating three types of information. First, clinical indicators such as symptoms and medical history. Second, social vulnerability factors, including language barriers, housing instability, and rural location. Third, system constraints such as emergency department waiting time, bed availability, and staff workload. By combining these three streams of data, AI can make more accurate, equitable, and context-aware triage decisions.
Traditional triage primarily focuses on clinical severity, but vulnerability is often shaped by social determinants of health. So traditional triage systems often disadvantage marginalized populations. While adaptive intelligence can integrate factors such as housing instability, limited healthcare access, and regional health disparities, allowing systems to identify patients whose outcomes may worsen rapidly if care is delayed. In this way, equity is not treating everyone the same. It is recognizing who faces greater barriers to achieving the same health outcome. Moreover, intercultural and linguistic factors are also very important. In diverse healthcare settings, language barriers, cultural norms, and different health beliefs can mask clinical urgency, further leading to misdiagnosis or delayed management. Patients may struggle to describe symptoms or understate pain. Adaptive systems can detect these hidden vulnerabilities by recognizing language discordance, health literacy barriers, and cultural communication patterns, therefore triggering culturally appropriate support such as interpreters or community-based resources. Importantly, the algorithm and learning systems should also continuously audit themselves for bias, ensuring that efficiency never comes at the expense of fairness. By combining clinical need, social context, and cultural safety, adaptive intelligence can help create a healthcare system that is both inclusive and sustainable.
While adaptive AI has great potential, it must always operate within strong governance frameworks. Patient privacy and data security are essential because the system relies on large amounts of sensitive health information.
Number one is privacy protection, which means that only necessary patient data should be collected and that it should only be accessed by the authorized personnel. Secondly, bias monitoring allows us to check if there are any unfair outcomes across different patient groups.
At the same time, AI models must be regularly monitored and audited to minimize algorithmic bias and ensure fair decisions across different populations.
All healthcare professionals should also exercise clinical accountability, meaning that they would remain responsible for the decisions made by the AI triage as well. Lastly,
the final triage decisions should always remain under human supervision. By combining AI speed and consistency with healthcare professionals' experience.
However, current triage systems do have important limitations. They often overlook social determinants of health, are affected by human bias, and struggle with language and cultural barriers. As a result, vulnerable populations may be under-prioritized and healthcare resources may not be allocated effectively. These challenges highlight why adaptive, data-driven triage is needed. In summary, adaptive AI improves patient prioritization by combining clinical, social, and operation information. It supports more equitable healthcare while helping emergency departments using resources more effectively. Importantly, AI is designed to support clinicians, not to replace them, creating safer, fairer, and more sustainable healthcare systems.